All right. Hello, guys. I'm Mike. I'm one of the PGY3 residents at Mayo. I'm going to get my screen pulled up here, but while I do, um, I'm also going to be joined today by Chris Ha and Josh Romero. They're going to be answering questions in the chat box. So if you want to ask any questions as I'm running through things, feel free to go ahead as I'm running through, and then we'll answer some at the end as well. So. All right, and thanks again to PM&R Scholars for getting everything sorted out here. It's a pleasure to be able to present to everyone. All right, so I wanted to start and talk just a little bit about why Mayo. I think as an institution, we have a lot of very unique culture here within the medical world that I think is valuable. We have an open door with world-class colleagues, and we're rated the #1 hospital in the world recently. Despite that, I think the people here is what really makes it special. It's an open door to talk to attendings at any time. We have a directory with everyone's personal pager on it. And if you have a question for someone who's on one of the patients that you're seeing in clinic, it's totally a normal practice here to just give them a call and ask the question in order to get the patient care the best it can be. And that goes along with the point here that the needs of the patient come first. And it's kind of a motto around here. And along with that, we get a lot of responsibility and accountability as residents, even early on, and that graduates throughout our continuity clinic and everything as we go forward. So it really makes you ready for independent practice. I think as a whole, education is prioritized here, both being educated by the attendings in our department, as well as educating the medical students. We lead the MSK course for the medical students and do labs and things with them. And then mentoring, again, we have research mentors and clinical mentors that are assigned or can be self-assigned if you have someone that you'd like to work with. Mayo as an institution has excellent resources to allow us to become good physicians, meaning that we're not spending time doing a lot of paperwork, prior authorizations, those sorts of things, and we get the research funding and research support that we need in order to learn to become good physician investigators as well. And then I think we also have an excellent work-life balance here, and we're able to make the most of our time outside of work because of Rochester's kind of unique climate. So this is just a few pictures of Mayo. The picture in the top left is of our downtown campus. This is the outpatient clinic buildings, as well as some procedural suites and radiology things there. And just in outpatient practice last year alone, we saw 1.2 million patients from all over the world. And when I say all over the world, it's very common. We have patients from the Middle East and Asia and things like that that are coming to Mayo as a destination for their care. The top right is just a drone shot of the Plummer building, which is one of the original buildings that the Mayo brothers built and still stands tall in the city. On the bottom left is a picture of St. Mary's Hospital. It's a big hospital and it's a level 1 trauma center. It has a very bustling surgical schedule as well, and so we get to work closely with a very busy surgery schedule. And then our inpatient rehab unit, you can't see in that picture, but it's brand new. It was built last year. We got a 2-floor rehab unit, and that's 36 beds, and it's connected to the hospital by a skyway, which means that we get the consulting teams and ability to transfer in things as if it's a part of the hospital as opposed to a standalone rehab hospital. Rochester, Minnesota as a city, so it has about 120,000 people in it as of the last census, and it lives bigger than that with the surrounding area, as well as the fact that there's a lot of tourism here because of the medical, how bustling Mayo's medical practice is. But it's also a beautiful place to live, and I'll highlight some pictures of Minnesota as a whole. It's not always a winter wasteland all the time. And in the bottom left, I just put a picture of some of the bike trails. They're always being extended, and it's a great place to be if you want to be outdoors. So the residency program as a whole, we have 8 residents per year. 2 of those are categorical that do internal medicine. at Mayo, and 6 are advanced. All 3 of us that are on the call tonight, Chris, Josh, and I, did the categorical program, so we're happy to answer questions about that. We have several fellowships. So we have a PEDS rehab fellowship, sports medicine in Rochester, Minnesota, and then sports medicine at Mayo Clinic Square, which is up in Minneapolis. Brain injury fellow, and then we have pain fellowship through the anesthesia department, where there are 5 spots total, but normally 2 of those or so go to PM&R residents. And then our campuses are Mayo Clinic in Rochester, there's Florida, Arizona, the Square up in Minneapolis, and then the Mayo Health System, which is in kind of the greater southeast Minnesota and western Wisconsin. And in the department, we have 40 attendings, which in Mayo speak is consultants. So, and that's just in the Rochester practice. When you're here, this is a schedule. So as a PGY2, you spend about half of your years in inpatient and half is outpatient. 3 of those months are on inpatient brain rehab, which is our acquired brain injury practice. And then 3 of those months are on spinal cord injury. And also you get the medically complex rehab patients as well. So post-COVID syndrome, et cetera. And then you have 2 weeks that are dedicated for research and some time in the outpatient clinic, which was spread around, and I'll highlight some of those rotations in the next slide. As a PGY3, I think one of the really unique things is at Mayo is that you're trained very well in procedurals and in procedures, and I'll highlight those numbers a little later too, but some of that comes from 6 months of dedicated EMG training, and that's a graduated program where you start with learning through didactics and then kind of guided cases, and then you progress to doing independent cases in the EMG lab, which I think is a pretty cool way of doing it. And then as a PGY4, you spend about 6 months of the year as well on inpatient again, but this time as a senior. There's 1 senior and 2 juniors on the unit at an even time per team. So for the brain team and the spine team. And then the other time is outpatient in research and in outpatient rotations. And speaking of some of those rotations, so on the left there are some of our inpatient months. But we also get a wide variety of outpatient practice. Mayo has, like I said, a very bustling outpatient practice, and so we get to see lots of kind of more niche things, like a specific month spent in hand clinic, just focusing on hand procedures and seeing outpatients with hand complaints. We have a lot of time in sports, so 6 weeks there, as well as time for electives to do more of that if you'd like. And then some of the other typical rotations that you'd see elsewhere, I think. Our call is home call, and you get less call as you go on throughout your years. Your 3rd year, you get even less because you're not doing any senioring. So you have 13 weekends as a PGY2, where you just cover your service, and then overnight you cross cover the 2 services. So a maximum of 36 patients. Most of the time, we're not totally full on our rehab unit. And when I was talking about our home, our work-life balance, we don't ever really get close on a regular basis to the 80-hour cutoff, and most of the time are more in the 50 to 60 hours, where it's much more reasonable, and you have time for things outside of work. There's a lot of things to learn here, and this is just a smattering of just in our department, but you can really have open access to anything that you're interested in throughout all of the departments as a resident. So we have Monday noon PM&R grand rounds. We have our afternoon didactics, which is 3 hours on Wednesday afternoons. During that time is protected, so the consultants pull all the pagers, and you get to go and they will handle all the inpatient things that come up, and you just get to really dedicate your time to learning. So it's not interrupted, and you really get to dig down into stuff. Those didactics are repeated yearly, and each year, especially in our ultrasound curriculum, the complexity increases. So you're allowed a little bit more freedom as you go through to kind of learn things that you need to focus on, and they push you a little bit more to really get proficient in a lot of these things. And then, you know, just about every area within PM&R, there are weekly or monthly didactics, as well as our monthly journal club that can focus on different areas within the field. I mentioned that we have a unique opportunity to get a lot of procedures. So these are just our performed numbers, not even our observed numbers. And as you can see, we get a ton of training, especially in our ultrasound guided joint injections and and using ultrasound guidance for Botox and all kinds of weird stuff. So you really get to be proficient with your tactile skills, your hands on the ultrasound and your hands performing the injections independently, so that you're ready to do that when you graduate, no matter what your practice will look like. Research is another area that we're really well supported. We get time for one national just attendance. We don't even need to be accepted, so we're allowed to do that once during your residency. So even if you aren't churning out a bunch of papers, you're able to go to something that you're really interested in. And then every year we get a local attendance trip where you pay if you need a hotel, but oftentimes it's either in the town or within a few hours. And the conference fee is paid for by the GME. And then you have 10 weekdays per year that you're allowed to take. That does not count weekends, so work days that you're allowed to take for presentations. And for every trip that you're presenting, at least pre-COVID, there's a lot of things up in the air, obviously, but you have about $1,800 to use for your travel and accommodations, and that's not including your registration fee, which is paid in full as well. We have a whole media center here that part of the support that they give you is that if you give them your abstract, they'll help you with formatting a beautiful looking poster because it represents the brand. And so it's one less thing that you have to worry about. You can really focus on doing the research and writing things up. And then we have established research mentorships that are provided for you unless you've already found one by the time those mentorships are being assigned. So. And then this is just highlighting what our residents go on to do next. So as you can see, there's a smattering of just about every type destination. Obviously, a lot of our residents go on to do fellowships because they want to practice in academics eventually, which is, if you want to go into a fellowship, you're really well supported in that. But at the same time, Dr. Wisniewski, our program director, says that he's just trying to train good doctors and he doesn't care about these numbers. And so you're supported in helping with contract negotiations and all those sorts of things going on in a private practice if that's something that you want to do. We get teaching on all those sorts of things too. And then this is just highlighting some of the things that are good about training here. So we have a subsidized employee-only gym that's full service gym. There are lots of social committees and well-being committees, both through the larger graduate medical education institution and then as well as within the department as well. There are outside of the medical record mental health resources through the employee assistance program. There's adoption stipends. There's all kinds of things outside of kind of the medical record that you're able to access if you want them. And then we do lots of community service events. We have protected time off for any appointments that you need to go to, kind of with no questions asked. And Rochester as a whole has a low cost of living with no traffic. You can get just about anywhere here in about 15 minutes, which is really nice to kind of maximize your time outside of work. And despite Rochester's low cost of living, our stipends are really excellent. And I also linked down here the benefits if you'd like to dig kind of more into what some of those benefits I talked about are. It's all public information. So, and then I just wanted to kind of highlight Minnesota in general. Life outside of work here is great, especially if you like being active and being outdoors. There's lake life is a big thing here. So it's the land of 10,000 lakes, and it's actually more like 15,000. So if you want to get out on the water, on fresh water, we have more coastline than California does. So it's easy to do so. The winter here, obviously it's cold, it's in Minnesota, but people take advantage of the winter and embrace it rather than kind of hiding away for too long. So people are out cross-country skiing and downhill skiing and snowshoeing and all kinds of things like that all the time. And then up north in Minnesota is I think the most beautiful country in the world. There's a protected federal canoe area wilderness. So there are all kinds of things that you can get outside and do. And this is just highlighting that we do those things with our co-residents and with our co-residents' families. There's some pictures here pre-COVID and some post-COVID, and this is we make an effort to really be with each other outside of work because we really like each other and get along. I think that's one of the best things about our program is the people who tend to come here and gravitate here really get along with one another and like being around one another. So it's great, great place to work. So I just linked some of our contact information here. Josh and Chris, like I said, are here with me. Feel free to ask any questions, and these are resources that you can reach out to after the presentation. I also linked at the bottom there our website if you want to dig kind of into more of some of these details, and happy to answer questions.
And if anyone has any questions, they can use the chat function.
Don't be shy, guys. We want this to be as full as possible for you. So feel free. Anything's on the table.
Yeah, so sports coverage is really cool. So we have a pretty bustling sports medicine department. If you'd like, so we kind of have formalized ways to do this just so it's super easy to get involved. We have like football coverage, and I'm going to highlight, I think next week, some of our spine boarding training and all that kind of stuff that we do. And then there's football coverage that you can get involved with. Soccer, honestly, if you just reach out to the athletic trainers that are all employed by Mayo and staff the high schools around, you could cover just about any high school sport that you want. And we also, at the Mayo Clinic Square, you can do an elective up there. They also provide coverage for the Minnesota Timberwolves and the Minnesota Lynx, so you can get professional basketball coverage on that level as well. So lots of areas to be able to do, and including adaptive sports. The Rochester Mustangs are an adaptive sled hockey team. There's adaptive skiing and snowboarding that they do. So lots of opportunities. Robin, I'm not sure. I don't know necessarily that we have virtual didactics set up on in a way that we can kind of have an open invitation to that. But I'm going to ask Dr. Wisniewski more about that. He's our program director, and I'll see if there's any opportunities for that. And if so, I'll send the information out to the PM&R scholars that they can distribute, or you can follow us at our Twitter too.
And we've got about 2 minutes left.
Cancer rehab, yeah. So we have a whole hospital that's dedicated to oncology care, essentially. And so while you're on the cancer rehab rotation, you are the primary point person on the consult team that's assessing patients for their rehab needs and deciding whether or not they come over to the rehab unit. So it's a lot of inpatient cancer patients who are kind of moving on to that stage of rehabilitation. Ramsey, yeah, leadership for sure. So one of the things they encourage us to do is get involved with the medical school, to get involved in the community and things like that. So certainly there are tons of opportunities for leadership and administrative training. I think there's an MBA through Mayo. So there's lots of things that if you want to kind of progress in that leadership role, you certainly can. James, the community service opportunities. So like I said, there's lots of adaptive sports coverage. People volunteer at running events. We do some, things have changed a little bit post-COVID, but we've done kind of group volunteer things through Habitat for Humanity and community outreach and things like that. Like different holiday gift giving things. So yeah, there's a bunch. Gerald, I guess I can't expand too much more than that. It's not something I've necessarily sought out myself. But feel free to reach out to me in an email, and I can dig up some resources and be happy to get those to you for more information.
All right, thank you all so much. That was a great presentation.